Ladies and gentlemen, I am most pleased to address you today at this important seminar on patients' rights and very much regret that other commitments prevent me from joining you in person, in particular as you will be discussing the Directive on Patients' Rights in Cross-Border Healthcare. While providing healthcare to patients is a responsibility of the national authorities, the European Union plays an important role in setting patients' rights and in laying the ground for policy initiatives to promote them. A high level of health protection, the right to benefit from medical treatment, access to preventive healthcare, these principles are enshrined in the European Union's treaty and in the European Charter of Fundamental Rights. These principles guide EU action and policy making. Let me highlight some benefits that the European Union brings to patients. The Directive on Patients' Rights in Cross-Border Healthcare, which is due to be transposed by all Member States by the 25th of October, gives Europeans the right to choose treatment in another European Union country and be reimbursed for it. The reimbursement is limited to how much such treatment would have cost in the home country. It also demands much greater transparency on quality and safety from health systems and providers across the EU. Soon, every patient will have access to comprehensive information about healthcare in every member state of the European Union. Patients will be able to check with the national contact point of the country of treatment what quality and safety standards are in place in this country, which hospitals or doctors meet such standards, and how compliance is checked. The national contact points will also provide information to their own citizens about their rights and entitlements in cross-border healthcare. This increase in information and transparency across the EU is important to enable citizens to transform the rights enshrined in the directive into reality. This is why I attach great importance to the contact points obligation to consult regularly with patient organizations to check if they are fulfilling their duties and patients' expectations. The Directive on Patients' Rights in Cross-Border Healthcare also enshrines the right for patients to have a prescription recognized in another member state. Under this directive, the European Commission has set rules on common elements for cross-border prescriptions. In practice, this means that people can take a prescription to another EU country and get the medicine they need. No need to visit a doctor abroad to get your medicine or to interrupt treatment. These are some examples of how this piece of legislation can make a real difference in people's lives. I am therefore particularly committed to helping Member States transpose this directive correctly into their national laws. Malta can count on me and my services to help in this respect. I will monitor the transposition of the directive in each EU country very closely to ensure that patients are effectively able to exercise their rights. I would like to encourage you to be proactive and to inform and advise me on the situation right here in Malta. You are the ones on the ground who can tell me whether or not the directive is delivering for patients in Malta. I count on your support and wish you a very productive seminar. Thank you very much.